Hello students, I welcome you all to OBGY with Mackler. So in continuation with primary amenorrhea, we are going to discuss an important topic here. So as of now, we have completed about the primary amenorrhea with the uterus being absent. Two conditions we have discussed, that is going to be Mullerian agenesis and the other is androgen insensitivity syndrome. In androgen insensitivity syndrome, we have discussed about complete as well as partial variant. Now we are going with the next part, that is going to be primary amenorrhea. Primary amenorrhea with the uterus present. So primary amenorrhea with uterus present, we have discussed many conditions, but in this module we are going to discuss about the most common thing. Okay, so the first is going to be about the cryptomenorrhea. Cryptomenorrhea. So first, let's discuss about cryptomenorrhea. So after discussing about cryptomenorrhea, then let's come to the primary amenorrhea with uterus being absent. Okay, so what is cryptomenorrhea? So cryptomenorrhea is also known as hidden menstruation. Why it is known as hidden menstruation? It is known as hidden menstruation because every month the female is going to experience some kind of cyclical pain, and every month menstruation is going to happen in her. But the problem is that the female is not going to have any bleeding per vagina. That is, whatever menstruation is going to happen in her, the blood is not going to come out per vagina. So the reason for this is what? So the most common reason for this is going to be imperforate hymen. Imperforate hymen is the most common cause. So what is imperforate hymen? We all know that in the vaginal orifice, that is the vaginal opening, we have an elastic tissue just surrounding the vaginal orifice, and that is going to be the hymen. If this hymen is going to be imperforated right from the birth itself, then whatever menstruation that occurs in the female, it will remain hidden because of the outflow obstruction, or because of the outflow tract obstruction. Whatever menstruation that is going to occur in that female, that is going to be collected inside in the vagina itself. It won't come per vaginum out. Can you understand that? Yes. So let me show the interesting diagram here. So here, as you can see here, the hymen is imperforated. Let me also show the normal. So as you can see here the hymen is perforated hymen. Okay, if this is going to be the vaginal opening, yes, the hymen is perforated here, but as you can see in this image, the hymen is imperforate. Since the hymen is imperforate, therefore whatever menstruation that is going to happen in this female, the blood is going to get collected inside the vagina. It won't come outside the vagina. That is termed as cryptomenorrhea because everything is normal in this female. The female's karyotype is going to be normal, external genitalia is going to be normal, internal genitalia is going to be normal, FSH, LH, everything is normal. From the hypothalamus, GnRH is getting released. It acts upon the anterior pituitary, releases the FSH and LH. This acts upon the ovary. Estrogen, progesterone is getting released. Estrogen, progesterone acts upon the uterus, and every month cyclical menstruation is going to occur. But the only problem is that there is outflow tract obstruction. The most common cause for this outflow tract obstruction is going to be imperforate hymen. The hymen orifice is not perforated, it is imperforated. It doesn't have any pathway so that it can let out the menstrual blood out. So every month menstruation is happening, but the menstrual blood is not coming out the vagina. That is termed as cryptomenorrhea. So we have discussed that the most common cause is going to be imperforate hymen, but there is no opening in the hymen through which the menstrual blood can come out, right? Okay. What is the second most common cause? The second most common cause is going to be the transverse vaginal septum. So transverse vaginal septum is the second most common cause. What do you mean by transverse vaginal septum? So let me show an example for you. As we have discussed in the earlier module, one Mullerian duct, right? It is going to give rise to half of the upper part of the vagina. This gives rise to half of the upper part of the vagina. So the upper part of the vagina, let's say for example, the upper part of the vagina is formed by the two Mullerian ducts, right? Now the The lower part of the vagina is formed by what? The lower part of the vagina is formed by the sino-vaginal bulb of the urogenital sinus. Is that clear? It comes from the sino-vaginal bulb of urogenital sinus. So ideally what happens is that the septum is formed. The upper part of the vagina and the lower part of the vagina is going to fuse. At around 20 weeks of intrauterine life, this septum has to resolve. If there is going to be failure to resolve of this septum, it is going to result in transverse. Since it is transverse, it is going to result in transverse vaginal septum. Transverse vaginal septum. And what is the cause for this transverse vaginal septum? Failure to resolve. What has to resolve? This septum which has been fused, the upper part of the vagina which is derived from the Mullerian duct, and the lower part of the vagina which is derived from the sino-vaginal bulb of the urogenital sinus. Both of them fuse together, but around 20 weeks of the intrauterine life, this septum has to resolve. But any conditions which is going to result in failure to resolve of this septum, congenitally it is going to result in a condition termed as transverse vaginal septum. So in such patients, whatever menstruation is going to happen from the uterus, the blood is going to be collected. Where does the blood will going to be collected? The blood will be collected inside itself. So there is outflow tract obstruction. So the second most common cause which can lead to the cryptomenorrhea is going to be transverse vaginal septum. The most common cause is going to be the imperforate hymen. Second most common cause is going to be the transverse vaginal septum. Is that clear? Okay. Now the third most common cause. The third most common cause is going to be vaginal atresia. Now what do you mean by vaginal atresia? Vaginal atresia means there is no vaginal opening itself. So first we learnt about that the hymen is imperforated. Hymen is the structure which is the elastic tissue which is surrounding the vaginal orifice. Only if the hymen is getting perforated, then through the hymen the menstrual blood can come out. Since it is imperforated, this imperforate hymen is the most common cause for this outflow tract obstruction leading to cryptomenorrhea. The second most common cause is the failure to resolve of the transverse septum between the upper part and the lower part of the vagina, leading to the transverse vaginal septum. The third thing is vaginal atresia, where there is no vaginal opening in the female external genitalia. So these are the most common cause causing outflow tract obstruction leading to cryptomenorrhea. Now, how can you identify these patients? So what are the complaints with the patient is going to come to you, and what are the examination you're going to carry out? So let's discuss about that. Okay. So cryptomenorrhea. Right? So what is the karyotype of cryptomenorrhea? It is very easy. You need not think about anything here, because cryptomenorrhea is a problem which is going to happen in females, right? The outflow tract obstruction because of this imperforate hymen or transverse vaginal septum or vaginal atresia, everything is going to happen in a female. Therefore, the karyotype is going to be of the female, 46XX. Is that clear? Yes. Since they are females, the gonad is going to be ovary, since it is 46XX. Okay, is that clear? Yes. Now coming about the FSH and LH. What about the FSH and LH? Everything is normal here. The menstruation itself is happening normal. The problem is only the outflow tract obstruction. Apart from that, everything is normal. Therefore, the FSH and LH is also going to be normal. Talking about the internal genitalia, she is a female, 46XX. Therefore, female internal genitalia is present. Coming about the external genitalia, yes, female external genitalia is going to be present in her. Is that clear? Okay. Now, what is the major complaint with which the patient will come to you? So, the major complaint with which the patient is going to come to you is primary amenorrhea. What is primary amenorrhea? A female who hasn't experienced any menstruation at all until now. That is any female who hasn't experienced any menstruation, the menstrual blood coming out of the vagina until now, she is termed as a case of primary amenorrhea, right? So the female will complain of primary amenorrhea. With the patient will also add upon that she has some kind of cyclical pain in the lower abdomen. So the patient will complain that she's having some cyclical pain in the lower abdomen. What do you mean by cyclical pain? Cyclical pain means, let's say for example, this is February. In February 20, the patient is having some kind of pain which is lasting for around 4 days. Same, in March 20th, the patient is going to experience the same kind of pain for the 4 days. And again April, May. So every month cyclically this is going to happen, that every 20th of the month the patient is having some kind of typical pain in the lower abdomen or say so, and the intensity of the pain is also increasing, right? So the patient will complain of primary amenorrhea with cyclical pain in the abdomen. The patient can also have complaints such as urinary retention. What do you mean by urinary retention? That she has some problem with passing the urine. No matter what, how much ever she passes her urine, she is having the feeling of urinary retention. The urine is getting collected up, right? So she can have complaints such as urinary retention as well. Okay, so how are you going to differentiate this female from the other causes of primary amenorrhea? So the best thing which you can do here is that if you're going to take it as a case of primary amenorrhea and carry out the basic investigations as well, let's go with that hand, right? So the basic investigation first is going to be history. So I have collected the history, followed by the examination. In examination, I have done the breast examination. It is normal. Breast is going to be normal. The external genitalia is going to be normal. Yes. Okay. So the UPT is going to be negative, followed by the ultrasound. In ultrasound, what you will be seeing, let me come this back, but in ultrasound the uterus is going to be present. Okay, so uterus will be definitely be present in ultrasound, right? Yes, in ultrasound uterus is going to be present, and then serum FSH is also going to be normal. But when you are going to do a local examination, when you are going to locally examine, what are you going to see? Let's divide this condition into 3, right? Let's divide this into 3. If I'm going to see a tensed, bulging, blue hymen. What is this? Tensed, bulging, blue hymen. If I'm going to see tensed, bulging, blue hymen, or the hymen is going to be normal, or there is no vaginal opening. So what are these conditions? Can someone tell me? Yes. So when there is no vaginal opening, it is termed as vaginal atresia. So there is no vaginal opening, so it is termed as vaginal atresia. Now, between tense blue bulging hymen and the hymen is normal, how are you going to differentiate this? So why it is tensed, why it is bulging, why it is blue, why it is looking like that? It is because of the reason that every month the female is going to experience menstruation, and whatever menstruation is going to occur in her, the blood is going to get collected inside itself. There is no bleeding per vaginum that is going to happen in that female. Okay, the menstrual blood is going to get collected inside itself. So because of that reason, since there is imperforate hymen, as you can see in this image, let's say for example, this is the hymen. Okay, let's say for example this is the hymen. Okay, and we can take into consideration a normal hymen as well. Okay, so this is the difference between the normal hymen and the imperforate hymen. The normal hymen is going to appear like something like this. Okay, but in imperforate hymen, whatever menstruation that is going to occur in her, that is going to get collected inside itself. So because of that, blood which is going to get collected in the female internal genitalia, it is going to appear bluish in color because of the blood that is going stagnant there, and it is going to be tensed, bulging. Why it is tensed and bulging? Because every month cyclically the menstruation is happening, and all blood that gets out from the menstruation, that is going to get collected inside the female's internal genitalia. So every blood is going to present here, so it is definitely going to be bulging because of the increased amount of menstrual blood that is getting collected in the female internal genitalia, and it is tensed. The membrane looks like tensed. That's so much that if you put a nick here, the blood will oozes out. So similarly, it's going to look very tense, blue in color, and it's going to be bulging. So if you're going to see tense, bulging, blue hymen, and you're going to do some cough impulse test. When you ask the patient to cough, if there is going to be tense, bulging, bluish hymen, then it is definitely a case of imperforate hymen. You're going to ask the patient to cough. So as the patient is going to cough, the size of the hymen is actually the size of the imperforate hymen is going to become even more big, that it is going to be more tensed and it's going to be more bulging. Okay, and the color is going to be blue in color because of the congestion of the blood there, which has been accumulated there. Whereas here, as you can see here, this is the normal. Okay, yes. What is the second thing? Here, the hymen is going to be normal and the cough impulse is going to be negative. Cough impulse is negative and the hymen is normal. So if the cough impulse is negative and the hymen is normal, what could be the most common cause? It could be because of the transverse vaginal septum. Can you understand this? See, this transverse vaginal septum is a septum which is located in the vagina. As we all know, let's say for example, let's take into consideration that this is going to be the uterus, right? This is the uterus. Following the uterus, we have the cervix, and following the cervix, we have the vagina, right? This is going to be the vaginal orifice, and surrounding this vaginal orifice, the hymen is still present. Okay, so the first condition which we saw was imperforate hymen. So in imperforate hymen, the problem is actually with the hymen. The problem is actually with the outflow tract obstruction. Therefore, the blood is going to get collected here. In those conditions, the blood is going to be collected where? The blood is going to be collected here, and it is going to cause more pressure, which is going to look very tense, bluish and bulgy. But in case of this is the vaginal orifice, this is the hymen. Okay. But in case of transverse vaginal septum, what is the actual problem? In case of transverse vaginal septum, the problem is not in the hymen. The problem is with the vagina, that either a transverse vaginal septum is present in the vagina. It can either be a low vaginal septum, high vaginal septum, or a middle vaginal septum. If it is going to be a high vaginal septum, middle, or a low vaginal septum. If it is going to be a high vaginal septum, then whatever blood is going to come out of the menstruation, that is going to get collected here. Right, that is going to get collected here. But if it is going to be a middle vaginal septum, then whatever blood that is going to come out of the menstruation will collect here. If it is going to be a low vaginal septum, then whatever blood that is going to get out of the menstruation will collect here. So it has nothing to do with the hymen opening. So physically also on local examination, you will never be able to identify the transverse vaginal septum. So if the hymen is going to look normal on the local examination, with the cough impulse test being negative, then it is a case of transverse vaginal septum. If on local examination it is a tense, blue, bulging hymen with cough impulse test being positive, then it is a case of cryptomenorrhea due to imperforate hymen, right? So cryptomenorrhea basically can happen to three causes. One is going to be imperforate hymen, second thing is transverse vaginal septum, third thing is vaginal atresia, right? Okay, so if you are going to do some rectal examination, what you will be able to see? On rectal examination, you can see that the uterus is actually enlarged. You can see the uterus is enlarged. Why this happens is that because whatever blood that is going to get collected here because of the imperforate hymen, whatever blood that is going to collected inside, that is going to reach the uterus and it is going to bulge the uterus as well. So the uterus is going to get bulged or distended with the blood that is going to get collected, so which is termed as hematometra. Metra means uterus, right? Or else it can get collected in the vagina as well. So if it is going to be the vagina, the blood can be collected in the vagina, which is termed as hematocolpos. Colpos means vagina, right? Hematometra and hematocolpos, right? Okay. Now, what about the breast and the pubic and axillary hair? In this condition, the problem is only with the outflow tract obstruction. So here, the breast is going to be normal breast development in female. Pubic and axillary hair is going to be normal because the androgens are present in a level that is supposed to be in a female. So therefore, the pubic and the axillary hair is going to be normal. Okay, so that is also going to be normal. On rectal examination, the uterus is palpable and it's going to be enlarged because of the collection of blood. The uterus is going to be distended with the menstrual blood, that is going to be called as hematometra. Similarly, the vagina can also be collected with the menstrual blood, which is termed as hematocolpos, right? Okay, now what is the management you are going to do in this patient? So the management of choice is that in case of imperforate hymen, if this is going to be the hymen, you have to create a cruciate incision here. So creating a cruciate incision over the hymen, so this cruciate incision on the hymen without disturbing the virginity of the female, a cruciate incision over the hymen is the management of choice. So through this cruciate incision, whatever menstruation that is going to happen in this female every month, the menstrual blood is going to get outside the vagina. So the female will experience a normal menstruation cyclically every month, and she will never have this cyclical kind of pain and this tense bluish bulging type of membranes being present. So the management of choice is going to be cruciate incision over the hymen. Is that right? Okay, so whatever we have discussed until now is all about cryptomenorrhea, which is due to the most three common causes: imperforate hymen, transverse vaginal septum, and vaginal atresia. Is that clear? I hope I have explained this topic in a very simple fashion. In case if you have any doubts or if you want me to repeat any topic, you can please write to us either in the Mackler handles or in the Gmail. Thank you. Please keep studying, students. Let's meet in another interesting module.